Alright, we roll. 2 days until the surgery. How exciting. I was thinking that it's a good idea to introduce myself. I already did 2 videos talking about my situation, the problem, but I didn't really tell anything about myself, where exactly I am. And then I will tell you about this cardiac episode that could end up my life, but it didn't. I got a second chance. And then I will tell you about this whole 2 months from that episode until now. Who am I? My name is Lukas. Łukasz. In Polish it's Łukasz, but for everyone it's Lukas. It's easier to spell, it's easier to remember. And I'm 30. This one you already know. I'm a physiotherapist. This one you already know. I'm a physiotherapist specialized in manual treatment. So as much as I respect exercise, training, I spent the first few years of my career as a physiotherapist only in the gym. Now I focus more on manual treatment. So with manual work, I take care of the quality of the tissues. So basically, I break down the scar tissue, the adhesions. I look for the irritations in the body that stiffen up the body. So to give you an example, if you had a fracture, for example, in your forearm, at some point it may turn out it didn't heal well, but you will not feel pain here. You will have neck and shoulder pain, and it's because of few mechanisms that occur. And I decided I work like this because there is only a little bit of physiotherapists that work in this way. There's plenty of physiotherapists working in the training part, and they're doing good. It's very important to have this kind of specialty, but the fact that I'm in my niche is much smaller, but it's also needed, so I decided to kind of switch to that. So this is what I basically do. This is my Instagram. I educate people about that, about chronic pain, because this is what I mostly take care of. And as you probably noticed from the name of the Instagram, I live in Dubai for 3 years already. I moved there with my wife, and we have a life there. And right now we are in so-called Siemianówka. It's a village in northeast of Poland. We are neighbors of Belarus here, and this is the room where I grew up. I am with my parents right now, and I'm here because it turned out that, funnily enough, fortunately enough, one of the best, if not the best, specialists in Poland performing this kind of a surgery that I need is 70 kilometers from here. When I ended up meeting that cardio surgeon, then I asked around, a few people around Poland that I knew. Everyone directed me here. So I was like, okay, I have no choice. Regarding my condition, it's very important to don't go to any kind of cardiology department. It's very important to go to the place where a lot of these kind of surgeries are performed. There are only few places in Europe, one in Germany, one in Romania, one in Italy, that perform big volumes of these kind of surgeries for HOCM, but this doctor is here. It's, by the way, it's close. There are a lot of factors just pushing me to just go here. Why I should go somewhere else if I have a very good specialist here? You know a little bit about me. Let's talk about this episode. So in the last video I told you how I ended up in the situation I'm in right now. Now what happened on the 29th? I laid down, I took a shower, I laid down, and at some point I felt, okay, let me get back to that moment in my head. In a split of a second, I felt that something is terribly wrong. That something is very bad. Very, very bad. First, it was just a feeling. I didn't know what is happening. I felt like it's not a feeling that you are like, okay, let's wait a few minutes, let's see what will happen. No, I told my wife that she needs to call the ambulance. Even though everything seemed fine, I just knew, you have to call the ambulance. Something but will happen in a few seconds. Theoretically, maybe panic attack, right? I was thinking in the moment that it's a panic attack, but it just felt very serious that I'm going to die in a second. Like I was kind of theoretically sure about that. It felt so bad. And then the symptoms started to unfold. The heart started to beat very strongly. Every beat of the heart, I felt in my head like my head is pumping. It felt like it will jump out of my chest. I started to be cold, like my hands and legs became cold, like dead. My digestive system was like something in my abdomen was just like off. There was no accident, right, that happened in my bed, but if you know what I mean. But I was sure it's gonna happen. It was just like my digestive system completely dysregulated. I had the perceptions from my abdomen like I never had in my life. Like it all turned off in some way. It felt like I am passing out. Like basically I'm losing life. Like everything becomes more distant and distant and distant. And in the same time, the room started to feel like smaller and smaller, and it felt like a lot of people started to scream at me in the same second. Even though it was only me and my wife, and she was very calm, and she was like she managed that perfectly. She was calm. She was joking a bit with me. She did everything step by step very properly. Like her stress response, perfect. I asked her to call the ambulance. I placed my legs against the wall to allow the blood to flow back to my brain. I really didn't want to pass out. I felt that if I will pass out, that's the end. So I did that. I wrote in my notes the name of the problem I have. I told my wife that if I pass out, that's what I have. To tell the emergency team that that's the problem I have. Then the ambulance was on the way. I felt like I didn't know what will happen in a few moments. I wrote down the bank details, the passwords, the password to my crypto wallet, and the instructions how to withdraw all the money for my wife, because I didn't know what will happen, right? So I was like, at least I will take care of this. Just in case she would be able to withdraw all the money without having to go to the court, stuff like that. That's the best thing that I could think of. Like I wouldn't have any amazing idea, anything to summarize my life. I was like, okay, let's make this time as useful as possible. So yeah, the emergency came after overall. It felt like 3 minutes, and I think it's because the ambulance was in the building next because of the fire. So they came very quickly, they were very professional, they took me to the very good hospital. They actually gave me a choice, we can go to this. I actually checked the reviews very quickly, and I went to the International Modern Hospital in Dubai. Awesome, like hospital, as a hospital, amazing. Like the way this hospital works, looks, the doctors there, it was an amazing experience. I felt really taken care of. And I met a very good cardiologist that knew exactly what is going on. They performed examination, they juiced me up with some medications, and I spent the night there, and the journey started. I was not sure what will happen. I took few naps throughout that night, and I felt so bad that I didn't know how it will end up. Going to the washroom after a few hours of laying down was recreating those unfunny sensations from the heart, this irregular heartbeat, the perception that I will faint. So the only thing I could do was just laying down and thinking about my life. I couldn't do much more. My wife was with me throughout that time. It was really important to have a close person next. It was really calming me down. Around the morning, I started to feel more or less fine. I was able to walk shorter distances, and I didn't feel so horrible. And I consulted with this cardiologist what to do, what are the next steps. Well, he told me to recover a bit at home, to rest, and we'll take it from there. Basically, he told me a lot about that from the surgical perspective. He was opting for me to have alcoholic ablation of the heart. That's the procedure that I was talking about in the previous video. Now, as much as he knew what he's doing, that he prescribed me beta blockers that helped to maintain more or less my heartbeat, he was great in a lot of things, but the treatment he suggested was, I was completely against this from happening. Like, it's a mixed feeling. This doctor was super nice, very helpful. I cannot say how much grateful I am for him. I was bothering him with WhatsApp messages way too often, like way too often. And he always answered and he always advised me well. But at the same time, he was very eager to operate me, to perform this alcoholic ablation. And yes, like, it's the most balanced option, but there were a few problems. The first one is that this hospital never had a case like mine, so I didn't want to be a first patient there. Like, absolutely not. The staff wouldn't know what they're doing. It could turn out that they don't have something, that something is missing. I was like, no, there is no way. And the second problem that I had that made me decide not to follow his way is that even though he was working in Egypt, where he's from, in the hospital that was performing these surgeries, he never actually responded to me when I asked how many of the surgeries he performed alone. I'm sure he did some of them, but he never told me the exact number, even though I asked a few times. So it made me question, is it really the best option? The surgeries like mine, like any kind of surgeries, the more experienced the surgeon is, the less likely is that some side effects will occur. And this surgery, as mine, should be done by someone who did it dozens of or hundreds of times. And there are only a few places in Europe, there are only a few surgeons in Europe doing that. And there is no surgeon like this in United Arab Emirates. They don't have a lot of cases like that, simply because the population is not much of local Emiratis. And people with this kind of, with HOCM, this is not the type of people who usually move to another country to work. People with that, they usually stay in their country, and they avoid risks, they avoid exertion. And I moved to the other country. It's a risky decision. I went there to work hard to earn money, and it's because I felt good enough. Like, my problem was not as apparent. I was able to train, work hard for so long. I was in a pretty good position. Also, considering how bad it could be, I'm not as bad case as it could seem. I have the gradient of 90 millimeters of Hg, but there are cases where people have 120 or 140 when they faint regularly, and it didn't happen to me. It's not as bad. So now, how did I recover? Now it hit me. It is very personal to share something like that, to talk about those things. It's a very personal journey overall, very personal situation. There's not many as personal things as your health being messed up, and talking about that. That's a high stake, very high stake, to talk about those things, to share the experience and maybe share advice, because some people can read it wrongly, or I don't know. Yeah, but advice can harm someone. So right now I felt the responsibility of this experience, of sharing all of this. What to do? I will try to be as reasonable as possible and to help people by sharing my experience, and avoid harming anyone with any stupid advice. I hope that you will learn from my stupid mistakes. The next few days were pretty crucial. I couldn't do much. Like, basically, my efficiency was very, very low. I had a massive problem going up the stairs, going for a long walk. The most apparent symptom was just an overall feeling of nervous system exhaustion. Like, my nervous system was fried. Small sound was causing my nervous system to be anxious. I Every small exertion was causing my heart to speed up to the crazy speeds. I felt like my heart will jump out in any second. The perception that I will pass out in any second was the worst. In the moments when it calmed down, I was able to have even 1 or 2 or 3 days where I could even forget that I have any kind of a problem. Then I only felt some pain, some pressure in the chest, some sense of oppression. But any day, any hour that I didn't feel this perception that I'm going to faint was awesome. And I felt that at least I'm resting. The moment when this anxiety, where this dysregulation was appearing, that was the moment that these were the times when I feel like I'm being exhausted, like I'm losing my strength. There was a decision to be made because a few days later I was supposed to fly. I had a consultation with my cardiologist in Poland on the 5th, and my family is Orthodox, so we celebrate the Christmas on the 6th. So there was Christmas. I didn't feel well. Honestly, I felt like I will be canceling that trip, but in the same time, I didn't have any other option. I got a clearance from the doctor. He told me that it should be fine since I'm on beta blockers now. It should be all right. So I went there. That was the best decision I could make, even though it was extremely stressful. My nervous system was completely fried, and I was exhausted all the time. But I went there. I got this consultation. I spent Christmas with my family, with my close ones, which was very important. And throughout that time, my situation was slowly getting better. So I came back to Dubai. Throughout this time, I had multiple consultations with cardiologists. Some of them were better than the other ones, but in the end, the resolution was simple. I need to undergo septal myectomy. Now, how I was preparing for that? The most important should be the perspective of the training. Depending on where I am, I should pick the exercises that felt alright to perform and slowly build up from that. That's typical physiotherapy. No matter how your health is messed up, you should find the starting point and slowly add up some training volume. And it seemed important because the better performance of the heart and lungs I will have, the better outcome the surgery will be. The issue with that was that since that episode, my tolerance of the training was like none. To give you an example, I was starting with breathing exercises, and it was awesome. It kind of relaxed me a bit, but at some point I decided to do slightly more intense breathing, and then my nervous system got fried for 2 days. And this was kind of like, okay, so what am I supposed to do? Just stick with the gentle ones? Yeah, I took a step back and I tried, and I was just doing this simple breathing, diaphragmatic exercises, and I didn't upgrade for anything more intense. With Pilates, I found few exercises that were not provoking any problems, and I was happy to do them. I had like 15 minutes sessions of Pilates, some very simple, very easy exercises, but to give you an example, the bird dog, like I didn't even do the bird dog. I was working only with my arms in the position on all fours. And the moment when I added legs, it was already too much for my heart. And I remember doing that exercise, and then for half an hour, I felt that like I'm going to die in a moment. So I was like, what's the point on doing anything? Progressing was creating danger that something bad will happen to me. And so I stopped. I was doing this very minimal amount of exercises, and I didn't progress from there. I was going for walks. Actually, this one I was tolerating quite well. Another time I was able to make bigger distances. But in the beginning, even going for a walk was a massive strain. A 1 kilometer walk was like running a marathon. Honestly, I remember going to the park with my wife, and then I was sitting on the bench, and I was like, okay, we take taxi home because that was too much. But over time, this distance got greater, and sometimes going for a walk was the only thing that was helping me. Very often, the irregular heartbeat, the perception of oppression was so big that I was not able to fall asleep. Then I was going for a walk around my district, around Al Barsha, and this was helping me. It felt like part of me is exhausted, but part of me has too much of energy, and I needed to burn this energy a bit. So randomly, in the middle of the night, I was going for a walk because I was unable to fall asleep. And the truth is that over time, over the course of those 2 months, it got better, because in the beginning, I had to go for a walk in the middle of the night almost every day. Then it became 2 times per week, then once per week, and throughout maybe the last few weeks, I didn't have to do it even once. So overall, I was recovering from that traumatic episode. The problem in my case is that the specificity of the problem is not allowing me to digest a certain level of activity. So unfortunately, from the perspective of movement, I'm not as happy as I could do. I don't feel very ready for the surgery. I would love to be in much better cardiovascular situation, but I couldn't squeeze more. I do as much as I can. I couldn't do anything more. Perspective of a diet. I moved to the ketogenic diet because of a few reasons. The first one is that when you base your diet on fats instead of the carbs, you lose a few kg immediately. Most of it is water. And since I moved to the ketogenic diet, there is no sign of swelling around my ankles, which is a very good sign. And I feel lighter. I don't carry a few unnecessary kg in my body. Most of it is water, some of it is glycogen that is held in muscles and the liver. And that's a massive benefit because it's lighter for the heart this way. Second of all, it regulates the mood. So when you base your diet on carbohydrates, there are swings on the diet based on fats. The mood is very stable, which is very important for me, and I'm sure it helped me to regulate my nervous system to some extent. So basically, my diet right now is a big amount of meat or fish, eggs, cheese, and vegetables. A lot of vegetables, a lot of veggies. I couldn't handle. It was suggested by many people to try the carnivore diet. I cannot. I love veggies. It feels like they charge me. It feels like it's a happy food for me. So I cannot resign from those. It feels good to eat them. And the perspective of supplementation. So basically, I got everything here, and we will go through all of this. So firstly, beta blockers. I have 2.5 milligrams per day. Very unfunny, very not very nice situation that I had with beta blockers was that I was told to take the highest tolerated dose. What is the highest tolerated dose? So it was not precisely explained to me, so I was adding half of pill until I felt that that I cannot handle it anymore. So beta blockers, they basically have some side effects. The side effect that I hate the most, that make me want to get rid of those pills as fast as possible, is that they make you foggy. They make you slower. They create certain curtain that the world is not as real, as apparent as it could be, as it is. But since it was important for my health, for survival, I was adding half pill per each few days to see how much I can tolerate. And I think at around 7.5, no less. I don't remember when exactly, but I felt that the fogginess is just too much, that I'm not able to do any kind of basic thing efficiently. So I started to decrease the dose, and I ended up taking 5 milligrams. And I thought that that is my maximum tolerated dose. Unfortunately, it was too much because it slowed my heart too much. And one evening I had a perception that my heart loses a bit. So I was reading a book and I felt like, oh my God, like I'm turning off. And then I was coming back. Then when I was observing my heart, it was basically like the pulse was below 50. It shouldn't happen. And I felt that sometimes it just stops to beat for a moment. And that was a pretty scary night. And yeah, since then I take 2.5 milligrams. It's pretty stable. So yeah, learn from my experience, watch your pulse, and don't ever allow it to go below 50. Now the supplement that helped me the most is this stuff. It's called Rhythmopask. I got it as a gift from one of my patients, and it's a homeopathic medicine. And honestly, I would most likely never buy a homeopathic medicine by myself. I always thought that those small dosages of anything cannot do much for your body, but it was doing quite a lot. So the moment I started using that, my effectiveness, my performance increased by easily 30%. I didn't have that much of improvement with beta blockers, with anything that I'm taking. This helped me more than anything. Obviously, it helps for me. If you're in a similar situation, it doesn't have to help for you. So always consult your doctor before taking anything. Don't take my word. So even though it's homeopathic, those doses, these are not small doses, honestly. These are not that small doses of certain things. I overdid that once. I think I did 3 times per day, 20 drops, because that's the biggest dose they suggested. And I started to have a low blood pressure. I'm not sure if it's because of that, but when I decreased the dose to 10 drops, then it disappeared. So it was most likely that. So even this kind of homeopathic medicine can mess up quite a lot. So always consult your doctor. The next thing that helped me the most was what was here, which is basically water. Really, the water was one of the most important things that helped me. It's pink because I charge it with electrolytes. Those are very good ones. I love this brand. I use them for a few years now. Basically, after this episode, I had very often the perception that something is, that my heart beats irregularly, that my nervous system is fried, that I am about to faint. And in most of the times, when this happened, all I had to do was hydrate myself nicely. So whenever this happened, what I teach myself to do was to get the bottle of water, charge it with electrolytes, and push myself to drink that, to flush everything. And it always helped. Like basically, it always helped me to calm down, to feel better. I'm not a person who is dehydrated. I really take care of hydration, and but in this situation, in the condition that I was, I needed more. The surgery is in 2 days. It hits me sometimes. Next supplement is just vitamin D. I take 5,000 units per day because I'm a big guy. But I was taking that before. I'm taking that right now. It's even more important because it's March in Poland, so I don't want to get sick. That's a basic thing. Another thing that helped me are peptides. Peptides are short chains of amino acids. They work in our body as transmitters, as hormones. Insulin is a peptide. There are few that I was taking. So basically, I use the company called UAE Peptides. They are from Emirates. I trust them. I know who's standing behind that company. Those are oral ones, and these peptides help me the most. These are for the adrenal glands. So they increased my energy levels. They help me to stress less, to feel better, to regenerate better. I have a few more. One for blood vessels, one for heart, and one for thymus. So basically lymphatic system. Those 3, I think, like I started to take them, but in the same time I felt to some extent anxious. To some extent that they gave me too much energy. And I decided that those will be the best after the surgery. I also have the injectable ones, but I don't take them right now. I have the consultation with someone specialized with peptides. So I have this consultation today, and I don't think I will take them before the surgery. I'm not sure how I will respond to them. If you decide to buy them, you can use the code that I have with them. It's do buy one. You will help me to compensate for the fact that I will not work properly for 3 months with some commission. HPA, I got it from the recommendation from an osteopath. Most important ingredients of this is ashwagandha, which helps me to relax a bit. It was a good thing. And I have also astaxanthin. I got it as a gift from my patient. It makes my nervous system feel better. It just feels that muscles contract better, that the thinking is better. One more thing. Obviously, what was important in the time of recovery, wow, it's going to be like 1 hour video. What helped me was decreasing the amount of hours. First of all, I couldn't handle more than 5 patients per day. And I didn't push myself for more. And this was a very important thing because I had time to manage doctors, examinations, formalities, and I had time to rest more. And I needed a lot of time to rest, a lot of time in nature, a lot of time to go for a walk. And this additional time really, really helped me. And there is one more thing that I got. It's this infrared lamp. It's I kept it for the end because physical therapy is the least important part of physiotherapy. It is used as the addition, as the cherry on top, and this guy, what does it do? It helps with the lymph, it helps with the lymphatic system, it helps with regeneration, it improves the mood, and it improves the mood amazingly, especially in this weather where everything is cloudy. When you turn it on, you understand why Polish people are a bit moody. It's because of the weather. And every time I use it, I feel calm, I feel this serenity, this nice feeling inside, like your body tells you that something nice, you're doing something nice to yourself. And that's good enough reason to have this kind of lamp. And I know that in hospital I will spend a week, and they will not allow me to go out for sure, definitely in the first few days. So this will be like my light therapy somewhere in that time, and that has a massive value to have a good mood during the recovery. I got the lamp from this company because one of my friends, she's using the lamp from this company, and it felt amazing then, so I knew that this is the good one. When I compared this company with the best companies that I could find here, it turned out that the power of this one, red light rising, is twice as strong as the ones available here. So I got it from this company from UK. If you would like to use this company, you can also use the code Dubai1, because I fell in love with them so much that I decided to collaborate with them as well. Guys, that's everything. That's the longest video for sure. My mouth is dry. And I feel a bit touched, honestly. I would love to hear all of that, those ideas. Obviously, there is the psychological part of the healing process, but about that, I think I will make a video afterwards, after the whole thing. I'm very glad that I did it, that I recorded this video. It makes me like, I did it finally. I was thinking about this for so long, and I finally did it. Great, guys. I don't know if I will record anything until the surgery. I think I spoke about everything so far that is important, that is crucial, and about the rest I will tell you later. Now it will be hopefully something from the surgery itself, from the hospital, if they will allow, and from the recovery. Okay, and so far, thank you guys for listening. Hopefully it helps someone.